legacy of this meeting. As Brian mentioned, today I'm going to share some thoughts on natural history for cuff tears, review some of the data that we've accumulated, and maybe share some ideas on how I use that data to refine my indications. And it's important to highlight that most of this relates to degenerative cuff disease. These are my current disclosures, which really don't apply. I must admit, though, the NIH supported our research for 15 years. We had 3 separate R01 grants studying the natural history, so shout out to the NIH. Why should we study natural history? It defines the risk of a disease progressing without treatment. And by studying that in rotator cuff, it allows us to identify higher risk tears, tears that progress faster, provides a baseline of function to compare against our treatment interventions, and it's important that we really don't have great natural history for traumatic tears. So most of these are degenerative tears that evolve over time. And I must thank Dr. Yamaguchi because he did the majority of the heavy lifting to get this research up and running. We know from the Moon Group that physical therapy works well for atraumatic degenerative tears, and that benefit is usually effective over time. 70 to 75% of patients will improve. The tear size at presentation is not predictive of how a patient will do, and the benefits are maintained at 5 and 10 years. But these are mostly clinical results. There's really not much imaging data for these tears over time, and these tears are progressing. So the fundamental question is, should we apply JED's data and say all degenerative tears should be treated non-operatively, or should we be more selective about our indications? Because there are risks to non-operative management. We know that